We need to wake the patient up. Slowly, just gonna rub the patient's chest until they wake up, wake up, wake up. Hi, shh, it's okay. It's okay, it's okay. You're in the hospital. You were brought to us unconscious, okay? You're safe here. We're gonna make sure that we get you all better. I promise we're gonna get you all better. Do you know what your name is? Okay, good. And do you know what year it is? Good. Do you know what street you live on? Very good. Can you tell me how many fingers that I'm holding up? Okay, good. How many fingers do you see? Good. How many fingers now? Good. How many fingers now? Good. Alright, very good. Hey, it's gonna be okay. We're gonna get you all better. Alright. We just want to run a few cognitive screening tests on you, and then we'll let you get back to sleep, okay? Alright. First, I just want to feel your forehead here, just to check your temp. Good, you don't feel warm. Doesn't look like there's any sign of a fever, which is good. I do want to take a listen to your heart and your lungs real quick. So I'm just going to grab my stethoscope here. And we're just going to take a quick listen, just to make sure everything sounds good. So if you would just relax, and I'm just going to take a listen. Good. And listen again. Good. Good. And can you take a deep breath for me? Very good. One more time. Good. Alright, well, your heart and lungs sound good. So we're going to go and do those cognitive tests with you. But first, I'm going to do a little bit of a skull examination. You were brought in unconscious, so I want to make sure that everything looks okay, alright? So I'm just going to have to lean over you. Alright, so you just stay still, and I'm just going to look around your skull here, through your hair. I just want to make sure that there's no bumps or contusions, lacerations, anything like that. Okay. Alright, we're going to just move down to the side of your head here. I'm just going to look at your ear. Make sure I'm not seeing any signs of outward damage or anything like that. Does anything hurt when I touch your ear here? Okay. Right. Just going to have to lean over you to the other side. Same thing. Just going to examine your ear. Anything hurt when I touch your ear here? Okay. Alright. Just gonna look at your face. Look at your face. I'm gonna just palpate on your temples. You let me know if there's any pain. Any pain. And up here on your forehead. Just press lightly. Press. Any pain? Alright. Look at me, and I'm just going to go down your nose, and then under your eyes. You let me know if there's any pain or discomfort. Okay. We want to make sure that we get you all better. Alright. I'm just going to feel your lymph nodes here, under your neck and jaw. Make sure that we're not seeing any kinds of swelling, anything that could be an indicator of what caused you to go unconscious. Can you swallow for me real quick? Good. You're doing great. I know, it can be scary to wake up someplace new, and you don't know how you got take care of you, I promise. It's gonna be okay. It's gonna be okay. Alright. Okay, again, I just want to inspect your face. Okay. Alright. Can you do me a favor? Can you open and say ah? Just open and say ah. Just want to take a look inside your mouth. Make sure I'm not seeing any broken teeth from any signs of a fall. Anything like that. Good. Just keep that mouth open, 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 open. Good, 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 good. Good job. I know. Alright. Just lift your tongue for me. Good. Alright, not seeing any sign of injury in the mouth, which is wonderful. Alright, how you doing? I know, well, hey, we have you in this private room. No one's gonna bother you tonight, okay? And when I'm done, we're gonna get you back to sleep. And if you need anything at any point during the night, you just press that button at the side of the bed, and the night nurse will come and check on you, okay? You are perfectly safe here, I promise. So, I do want to work on those cognitive screening tests with you. So the first one we're going to do is a little olfactory test, which is your sense of smell. So I have a little jar here, and I'm just going to occlude, which means block, one of your nostrils. I'm asking you to smell. What do you smell? Citrus, very good. We're going to do that again one more time with the other nostril. Another jar here. Alright, and we're going to occlude, again, occlude and block. And you take a sniff. What do you smell? Pine trees, very good. Very good. Well, we at least know that your nose is still working. I do want to check that out one more time. You let me know if there's any pain on your nose here. Any pain on the nose. And on the sides of the nose. Good. Good. Alright. Now I would like to examine your eyes. So what I'm going to do is take my fundoscope here, which is this nifty little light. It has a little magnifying lens in it that lets me observe the fundus in your eye. So I'm going to start by adjusting this down to the proper depth. And I want you to just look at me, and I'm just going to observe your eye from over here. Good. Just keep looking at me. Good. Okay, I'm going to lean over and observe the other eye. Same thing, back up, back up, back up. Good. Again, right at me. Good, good, good. Alright, very good. Now I'm going to do the same thing, and I'm going to adjust it. And I'm going to get very close head to head with you so I can look deep in that eye. So just keep that eye open. Look at me, look at me, look at me. Good job. Now look up. Good. Now look down. Good. And to the left. Good. And to the right. Good. Okay, same thing. I'm going to have to lean over you here. And the other side, you look straight into the light. And good. Look up. Good. Good. To the left. Good. And to the right. Good. Wonderful. Well, the inside of your eyes look good. Now I want to actually focus on that ocular motor nerve and make sure that those eyes are still working properly. So we're going to start very simple. I want you to look straight at me. Good. Now look at my finger. Good. Look at me. Good. Finger. Good. Look at me. Good. Look at the finger. Good. How many fingers am I holding? Good. How many fingers? Good. 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 Very good. Alright. So now I want you to not pay attention to my finger, but follow the light with your eyes. And just follow the light. Don't look at my finger. Follow the light. Ignore the finger. Good. Good. Alright, now I want you to close one eye and follow the light. Good job. Follow the light. Good. Follow the light. Good. Alright, and close the other eye. Same thing. Follow the light. Good. Follow the light. Good. Good job. Good. Wonderful. Now I would like to make sure that your sense of peripheral vision is still intact. So you're going to look straight at me right here in my nose. And you let me know when the fingers come into view and when they leave, okay? So here we go. Good. 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 Very good. 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 Wonderful. I do need to test your blink reflex still in each eye. So what I'm going to do is take this tiny little wisp of cotton and I'm just going to gently brush along the corner of each eye just to elicit a blink response. So here we go. Good. And the other side. Wonderful. We're going to do the same thing again, except this time we're going to use a little puff of air. You just look straight and puff. Good. Look straight and puff. Very good. How you feeling? You doing okay? Alright. Well, we're still going to be looking at those eyes of yours. We're just going to do a little basic eye chart here. As I said, we think you hit your head. We just want to make sure that everything is still good. So just read top to bottom. Good. 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 Yes. Yep. Very good. 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 Wonderful. And how about down here? Good. 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 And yes. Well, I have to say so far, I think things are looking very promising. That this might have just been a bump on the head. But we're going to be thorough. you just stay with me for a little while longer, okay? For the next portion, I'm going to see if you can do some color recognition for me, okay? So what I'm going to do is hold up this little color gel here. I'm going to take this light and I'm just going to, and you tell me if you can see the light, okay? Alright, so here we go. And can you see the light? Good. Do this one. Can you see the light? Good. And this one. Can you see the light? Good. Just a few more. And this one. Can you see the light? Good. And this one. Can you see the light? Good. I just want to do one more test with you. Very, very simple test. It's called a cover test, where I will just swing the light in and out. Just checking your pupil dilation, okay? So you just hold still. I'm going to make this real simple. Light swings in, light swings out, and in, and out, and in, and out, and in, and out, and in, and out. Alright, and now we're going to do the other side. And in, out, in, out, in, out, in, out, in, and out. Wonderful. Well, my friend, the eyes look good. So now we're going to look at those ears of yours. So this is very simple. I'm going to ask you to close your eyes for me. And I'm just going to make a sound in each ear. You let me know if you can hear it. Good. 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 Very good. Keep those eyes closed. And you let me know if you can hear the word purple. Good. Pancake. Good. Coconut. Good. Relax. Good. Chocolate. Good. Dream. Very good. So your sense of hearing seems to be intact. So I'm just going to take my otoscope and take a look inside those ears. Just to make sure everything's looking good. That there's no problem. So we'll take my otoscope here. Turn the light on, as you can see. And I'm just going to reach over you and take a look at this ear. Just going to gently put the otoscope inside. I know everything looks pretty good though. The tympanic membrane looks to be intact, pearly white, no signs of abrasion or puncture. Good. Very good. Okay. Alright, now we're going to take a look over here. Same thing. Just going to slip the otoscope inside. Good. Take a look. Good. Tympanic membrane is intact here. No punctures. No abrasions. Very good. Alright. Well, the ears look good. Just what I'd like to see, I am going to do a little inspection though again, because I want to make sure that we're not missing anything that could possibly lead to something worse down the line, you know. Okay. Yeah, I know. Other parts of the hospital are kind of noisy at night sometimes. Sorry for that. always seems to be some kind of new wing being built. Okay. Alright. Well, my friend, we only have one more portion of the exam and then you get back to sleep. And this portion might even put you to sleep. It's very, very simple. It's just a sunlight sensation exam. So, to do this exam, I'm going to be touching you with multiple objects, such as this little pressure tool that is very dull. And I'm also going to use objects like this pinwheel, which are a little sharp, but will not puncture the skin. We're actually going to start with this. I'm just going to use it on your arm. You just let me know if you can feel it, and then we'll put it away, okay? So you just close your eyes. I'm going to run the pinwheel up your arm. Good. And the other arm. Good. One more time. Very good. And we'll put that away. Okay. So now I'm going to do a little more sensation testing with you by either touching you with the soft cotton swab or the dull tool from before, okay? So you just keep those eyes closed for me. And you tell me if it's dull, good, or soft, good, dull, soft, dull, very good, soft, yes, and that was dull, dull, good, dull again, soft, 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 good, dull, very good, soft. Keep your eyes closed, and we're going to just test your very light sensation of your skin with some puffs of air. So you just let me know if you can feel it. Good. 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 On your neck. Good. 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 Alright, well, if you'd like, you can open your eyes, but I have determined that cognitively you're very, very, very all good. So, we're gonna let you get back to sleep now, okay? And in the morning, the nurse will come, check up on you, get you some breakfast, and I will come see you shortly after that. So why don't you get some sleep and close those eyes, okay? Alright, and we'll see you in the morning. Get some rest, get some rest, get some rest, get some rest. Good night.